This is an NCLEX tips you don't want to miss. If you're prepping for NCLEX, you need to watch the entire video. So in tip number 1, we're going to be talking about myelomeningocele. Now let's get that started. So myelomeningocele is a severe form of spinal bifida. So what happens is the spinal cord plus the meninges, they protrude through an opening in the spine. It's usually in the lower back of the infant. Because the spinal cord is exposed, there are two major risk conditions that you have to worry about. And they are, let's look at that, they are infection and neurologic damage. So right after birth, the sac must be kept moist with sterile saline dressing, and the infants are usually placed in the prone position to avoid pressure on the defect. So most of these children are going to have hydrocephalus, right? And because they're going to have hydrocephalus, more than likely they're going to end up with a BP shunt. So now the teaching point of NCLEX, and they like to ask these questions, is what are the health teaching that we're going to give to the family members, to the mom, to the dad, to any family members of the infant. So children who has myelomeningocele tends to have neurogenic bladder. So we teach families that they need to learn how to do clean intermittent catheterization to prevent urinary retention and infection. The other thing that we also teach the family members is to watch for signs and symptoms of shunt malfunctioning. So what are those signs and symptoms that we have to look for? First is vomiting. That's usually what you're going to see the first time. The second is irritability. And the number 3 signs of BP shunt malfunctioning is there is increase in head circumference. So remember this, when you have a question related to myelomeningocele in your NCLEX exam, these are the things that you need to know. Protect the sac by covering it with sterile saline dressing, prevent infection, and of course, monitor hydrocephalus. So again, if you're prepping for NCLEX, you need to watch the entire video and subscribe to my channel. Thank you.